The UK Health Secretary Steve Barclay says flu and COVID have put, quote, massive pressure on the NHS. He was speaking yesterday as other parts of the UK went back to work after the winter break and as the UK Health Security Agency reiterated the importance of people wearing masks if they are ill and need to go out. Well, Scotland's National Clinical Director Jason Leitch joins us now. Good morning to you.
Morning, both. How are you?
Good. Happy New Year to you. Thanks for being with us.
To you.
I want to come to masks in a minute, but first let's just look at the broader issue. I mean, much of the testimony that we've been hearing from staff and from patients as to the state of our hospitals at the moment is actually pretty harrowing. When you listen to the details and what's going on in there, particularly in A&Es. How would you assess where we are just now in terms of patient care in Scotland?
Yeah, it's tough. It's really tough. It's tough particularly for patients and families, but it's also tough for all the staff, the clinicians and the managers who are trying to solve as many problems as they can every day. A&E is, of course, where the headlines come from, and it's right. I've spent some time there in the last couple of weeks, and it's not a fun place to work, and it's not a fun place to receive care, frankly, but it's not just A&E. A&E is the kind of canary in the coal mine, Martin. It's GP practices, which will reopen today. It's community pharmacy. It's dentistry. It's across the whole system. It's very, very, very busy.
I mean, we're hearing now doctors, senior clinicians saying the system is broken. I mean, we've heard breaking point frequently and warnings up till now, you know, in the last few years. But people saying the system just isn't working anymore. It's broken throughout. Do you recognise that analysis?
I recognise that there are challenges throughout the whole system. I think there are things we can do, though. If we become hopeless at whatever level in the system we are, whether we're a patient and a family, a carer, or a senior advisor to the government, or one of those clinicians who today is turning up after maybe a couple of days off, or on the 7th consecutive shift they've done in A&E over New Year. I think if we lose hope, then we're in trouble. So there are things we can do in the system to make it better. Some of that is going to be to hold our nerve to get through the winter because of, exactly as your introduction suggested, flu, strep A and COVID, all layered on top of a backlog and a long 2-4 day bank holidays, all of that. But there are things you and I can do to make it that little bit better.
Yeah, I mean, what are the figures? Well, let's get on to what we can do in a minute, because there was talk of masks, all that kind of stuff. But let me just look at exactly what's going wrong here, what is happening. Figures down south suggest about 1 in 8 hospital beds in England is occupied by someone with COVID or flu. Do you have equivalent figures up here at the moment?
Yeah, it's about the same. Some way it varies between 1 in 8 and 1 in 10. And we've also got people, remember, in hospital who are fit to leave hospital. Across the whole of European healthcare systems, this is probably the fundamental problem that isn't just a winter problem. We have people in hospital who are ready to go home, and our care system, not because it's not working hard enough, just because it doesn't have capacity. We haven't kept up over the last 50 years with the demographic change in people aging, living longer, because the health service is such a wonderful institution, actually getting people to live longer. But many of them are unhealthy and they need care when they're at home. 800,000 people do that themselves. They have unpaid care from their family, from their friends. But we also have a statutory care system that is trying really hard to step up and help those individuals.
That's a long-term fix. You're saying it's half a century of failing to keep up with the demands of a healthier and ageing society. There has to be stuff done in the short term as well, doesn't there? I mean, it's not just flu. This seems to happen kind of every year, even pre-COVID. The Red Cross declared a humanitarian crisis in the NHS in 2017 because flu and winter illnesses had hit the system so badly. It's almost like the NHS just can't cope with winter anymore, isn't it?
It is hard. It's definitely hard. And that's frail elderly, respiratory viruses. But there's things you and I can do, Martin. We can use the health service wisely. So 500,000 people have used NHS Inform to look up details of strep A and how to manage fever and sore throat in their kids or in their elderly relatives. That's where you should go for your first source of information. It will also help you with when you should escalate to community pharmacy, to GP practices that will reopen today, to A&E if you need it for your accident or your emergency. We should also look after each other. We should care for those around us, whether they're relatives, friends, neighbours. There's things we can do to help each other. And and we shouldn't pass on diseases to others. Now, this is a new culture for Scotland. This means not going to the BBC if you're sick. It means not going to your office, not going to drive that bus. If you have a virus, if you're not well, you should stay at home and not pass that virus on to others.
And what I'm also hearing in that suggestion is don't go to a hospital, basically, unless you absolutely have to, right? Avoid hospitals.
Well, I wouldn't use the word avoid hospitals, but remember the health service is a pyramid. At the bottom of that pyramid is our websites for self-care. Then we have NHS 24, 15,000 people phoning NHS 24 every day for information. 9 out of 10 of them get definitive care in one phone call. Now, people are yelling at the radio now because it takes a bit of time to get through. I understand that. It's very, very busy. A lot of people need it. So you might have to be patient. You might have to hold on for a little bit longer than you would like and than we would like, but you'll get the right advice. Then you start to access personal health care, pharmacy, GP, dentist, and A&E is for accidents and emergencies. It's absolutely there. If you have a stroke or a heart attack, or if you fall and an ambulance needs to come get you, it will come. But the system is stretched, so it all just needs a little bit more patience from all of us.
Is this long-term advice, Jason? I mean, are you saying now we have to reassess how we change the way we use the health service right throughout the health service for good?
I think we've been saying that for a number of years, and most of us know it. I mean, most of us know not to go to A&E with a 3-week-old sinus infection. That's not what we're saying.
But if you can't get to your GP, some people will be feeling that's the only option that's left.
Yeah, and that will also be being yelled at the TV. I know GPs are working really hard. They've got care teams. It's not just doctors, it's nurses, it's physios, it's mental health workers all across primary care. And they will be going back today and they'll be pressed. Their phones will be ringing off the hook this morning. So just go easy. If you can wait, then it would help us if you could just wait a little bit longer. There are longer term things we can do, Martin, and that's another conversation for another day because we're not a healthy nation. We're putting pressure on the health service because we're too big, we're not eating well enough, we're not exercising well enough. So there are things that the health service and the care system need to do for the longer term prevention of this type of winter going forward.
Coughs, colds, splutters, all that kind of stuff. You're saying don't go to work. Others are saying put a face mask on if you're going outdoors. Do you back that?
I do. I don't think that's a bad idea at all. If you look at Southeast Asia, one of the cultural differences in Southeast Asia is if you are unwell or recovering from a virus, or you feel as though you've just got that scratchy throat at the beginning of a virus, then you wear a face covering. You wear a face covering in the shops, in the streets, in public transport. That would be no bad thing for Scotland and the UK to inherit from the COVID pandemic.
Do you think people will do it here? For a lot of people, it's a kind of unwelcome throwback to a really pretty unhappy time.
It is, and I completely understand that. We have thrown off the shackles of COVID, haven't we? We think it's over. Well, let me tell you, 2 million people in Britain have COVID this week. 2 million. There are 800 people in hospital seriously ill with COVID, often with another disease. So COVID is here to stay, and we're going to have to live with it. And I think you can agree, society has learned to live with it. But if there are things we can do, like maybe look out that alcohol gel you had in your pocket, I wonder if you and the BBC have been using alcohol gel at the front door quite as much as usual.
Yeah.
The civil service buildings, we've just let that slip a wee bit.
Sure.
All of that we need to get back to.
Yeah, got to change our ways, change our mindsets, get back into thinking about health first. And we all right, Jason Leitch, many thanks indeed, as ever, for your time.